in order to implement these health information technologies and to operate them on a day-to-day basis, you need an adequate workforce. I represent the city of Detroit, the Metro Detroit area. We have very high unemployment, but also we've got some great hospital systems. The potential for job growth in that region and also nationally because of the complexity of our health care delivery system and the growing number of people who need health care, we're going to need a lot of people in this workforce area. An interoperable health IT system will create jobs. The HITECH Act directed your office, the Office of National Coordinator, to establish education programs, which I think is great. Now, one thing that causes me concern, though, is this eHealth Initiative survey that indicates that nearly a quarter of the health information exchanges are not hiring students from ONC-funded workforce development programs. You know, if Dr. Mostashari or anyone here would like to comment on that, I mean, is this survey accurate? Is there some fundamental basis for concern about the adequacy of the training programs that your office is funding? And if that's the case, what can we do to correct that? I mean, my assumption is that this is a whole new industry that can be created that could transform our entire workforce nationally and even internationally. How can we get people prepared to operate these health IT systems?
Your concern is very well put. There is going to be a lot of jobs and there are a lot of job openings, huge increases in job openings for skilled health IT workforce, even as we have many students and others who would wish to fill those jobs. So to meet that, we've established a curriculum that is openly available. We've created a competency exam working with AHIMA. We've funded university-based training slots, as well as 81 community colleges that have graduated over 15,000 students to meet the expected need of 50,000, shortage of 50,000 jobs in healthcare IT. As you say, one of the things we've learned is if you don't have experience in healthcare, it's hard to get into healthcare IT and get a job. So one of the things we're working with, for example, in Ohio, the community college there is working with a hospital association to have internships and placements and apprenticeships. Those are, I think, some of the answer to making these two sides connect up with each other.
Thank you, Doctor. Anybody like to comment on this?
I actually would.
Dr. Fields.
Thank you. I would like to expand on the program through ONC. I personally use some of the slides that have been posted to teach my students graduate students in informatics and nursing. So what that says, you don't capture that in your numbers of the benefits. So I'm using the materials that ONC has funded through work done by others. I then have up-to-date information that I can incorporate into my classes, which make the graduate students in nursing more capable of taking these complex HIE jobs. And then when they move into the healthcare IT positions, it opens up less experienced types of positions, which the survey that you quoted and the information, Dr. Mostashari, that you talked about, this information, these data don't get captured.
Thank you, Dr. Fields, and I yield the balance of my time.